Hi everybody, this is Dr. Matt Kostura from the Emergency Services Institute. I'll be presenting my poster on Emergency Medicine Residency Airway Lab in the COVID era. I'd like to thank Dr. Smalley and Dr. Jimenez for helping me with this poster, as well as for helping with the lab. I'd also like to give a shout out to Dr. Stephen Dorsey, Dr. Leanne Stratton, Dr. Achilles Bibos, Dr. Josh Cubitt, Dr. Val Lopez, and John Lindsay for also helping out directly with this airway lab this year. Okay, so a little background. So we have an emergency medicine residency airway lab as part of our July training for interns and residents of all levels to help our emergency medicine residents learn how to handle emergent airways. Now in the past, this lab involved both group lectures, expert airway panel discussions, as well as hands-on stations where the residents would get to practice with various airway equipments. We involved some of the equipment reps as well as instructors at the stations. Well, in the COVID era, we realized we couldn't handle the lab as we had previously done, mostly because half the lab involved large group discussions, and that would not be possible to socially distance and keep the minimal number of people in one group. So we had to think outside the box a little bit here. In addition, we felt this year it was important to train residents on how to safely intubate and resuscitate a potential COVID patient into the lab, both from a patient safety and caregiver safety standpoint, as well as understanding some of the physiology associated with intubating a patient who's COVID positive. So, how do we do the course this year? Well, it was divided into two sections. First, there was a group lecture done via Zoom on the week prior to the hands-on session at the Sim Center. So they got all the information and introduction to the simulation center during that group lecture that was virtually done. And then second, we had a 4-hour session at the Sim Center that consisted of the 8 separate either simulation or procedural stations done. We had 5 procedural stations and 3 simulation stations. We had 1 instructor at each station, and as the residents came in, they were separated into no more than 5 learners per station. This allowed us to have adequate spacing at the station so that residents could stay 6 feet apart as much as possible. I will admit this was a little more challenging in the simulated stations, but we tried to adhere to distance guidelines as much as possible. We used frequent cleaning of equipment, and of course, everybody wore masks. So for our outcomes, we wanted to know, well, what do the learners think of running the airway lab this way? As you can see, the overall feedback was very positive. They loved having that extra time at the hands-on station, which was actually initially incorporated to allow for more cleaning and allow for more social distancing, but it had a nice side effect of allowing more education to occur as well. So that's something we'll consider in our next steps, is how we can incorporate more time into the separate stations for next year's lab. Additionally, we've incorporated more simulation into the airway lab every year, and it would be nice to rotate different sim situations on a 3-year basis because our residents have a 3-year residency, so they're seeing something different every year. So this is a great lab, and I'd once again like to thank the Sim Center for a successful airway lab despite the challenges that COVID presented this year.